Gynecologists of Reddit. What's the worst thing you've seen/most awkward experience? My sister's boyfriend was doing a gyno rotation. He was quite upset, as he was examining a woman that from sight and smell alone it was obvious she had cervical cancer, so advanced that she wasn't going to make it. For the first time on that rotation, he had to warn someone about their imminent death. It was all very depressing and solemn, so it was quite a relief when it turned out to be a tampon that had been in there long enough to resemble a tumor. Edit. On TSS, someone correct me if I'm wrong, but as I understand it, the bacteria that causes TSS is either present in patient or not, like MRSA. TSS is not an inevitable consequence of disgusting tampon behavior, one that a colleague in OB/GYN shared a while back. A woman was in for a pelvic exam, is up in the stirrups, and my colleague has her fingers in up to the cervix. At this point, something possesses the woman to ask, and I quote, "So, do you ever think about stuffing a turkey while you're doing this?" My colleague, try to keep a straight face, answers, "No, but now I will every Thanksgiving." The woman finds this hilarious and proceeds to stare my colleague dead in the eye while yelling, "Gobble, gobble, 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 gobble," with my colleague's hand still up her hoodie-hoo. I still enjoy telling that story to friends at Thanksgiving. It means more turkey for moi. My mom works as a gynecologist assistant, and she has told me a few stories. A woman once went in and apparently filled an entire room with her putrid stench. She had been wearing the same underwear for 2 months, and her panties, which were originally white, became a darkish yellow-brown. She apparently wasn't very good at wiping either. Not a gyno, but was an EMT/firefighter about 10 years back. Treated a very attractive woman who decided to dump about 4 ounces of Drano into slash on her vagina to kill the sperm that her date left in her by accident. Just think of an English bulldog who got popped an Alka-Seltzer, got into a Costco-sized jar of mayo, and then was punched in the face about 10 times. That's what it resembled. To add to the awkward factor, about a year later, I met a very attractive woman at a grocery store, got her number, and met her for drinks. Later that night, we ended up at my place making out. As soon as I started taking her shirt off, I suddenly remembered that the girl who I had taken out for drinks was the one who previously dumped Drano into her vag. Our night ended abruptly and awkwardly, as you can imagine. This is a story from a friend's dad, happened 3 summers ago. An overweight woman comes into the office for an STD test and pelvic exam, complaining of colorful discharge, an awful stench, and burning during urination. She assumes she has gonorrhea. Wrong. It was much worse. He gets in there for the pelvic exam, all the while assaulted by the stench of rot, and finds a fucking dead frog in her vagina. This thing is heavily decomposed, since the warmth of the woman's vaginal cavity has helped to speed up the process, and he has to pull it out piece by piece. Needless to say, she also had a wicked UTI. The woman explained that she'd passed out naked and drunk/high/whatever at some party at her boyfriend's house, and figures he or one of his friends must have thought it would be an absolute riot to put a live fucking frog up her vag. She apparently did not seem bothered by the fact that an animal had died and decomposed in her vagina, just relieved she didn't have gonorrhea. Edit. For extra gross-out factor, it's worth knowing that this was in Memphis, Tennessee, where temperatures routinely get well over 100 F, with over 90% humidity. Think about that. Surgeon here. I was doing a pediatric surgical rotation when an 8-year-old girl was brought in by her parents in ER for vaginal bleeding. I was called in to have a look at her because the nurse could see something inside. Yep, there was stuff inside, and lots of it. Pencils. She used to pleasure herself with pencils. Took her to theater and removed more than 20 pencils from her. Scarred for life. Can never look at pencils without remembering that. 3rd year of medical school on my family medicine rotation, which I'm doing on my med school's campus academic health center. Electronic medical record shows 24-year-old with chief complaint of cough, so I go in to interview her. Where it comes to light, she's really there for vaginal itching. Finish up the interview and tell her I'm going to grab my attending for the pelvic exam. My attending tells me she'll let me do the pelvic if the patient consents. I had already done OB/GYN at this point and was quite comfortable with it. But we both agree I'd likely get asked to leave the room altogether. Lo and behold, patient consents. I do the pelvic. We write her a script for some antifungals, and she goes home. 2 days later, I'm teaching a small group of first-year students how to perform an abdominal physical exam. Teaching is a requirement of the family medicine rotation. When, during introductions, I come face-to-face with my patient who never mentioned she was a first-year student. We both play it off really cool at first, but during the session, her partner asks me to show him how to do an inguinal/femoral hernia examination on a female patient, aka his partner. While I'm doing my exam, she breaks out in hysterical laughter, which causes me to lose it and start laughing at the absurdity of the situation as well. She played it off like she was ticklish, and I said something stupid like, "I thought of something funny. Don't mind me." 2 weeks later, she returns to the clinic for a follow-up, and I go see her. We talk for a while about how she's feeling, how awkward our second meeting was, and then just shoot the shit for a bit when he goes, "So, when are you going to take me out to dinner?" I politely declined and explained I had a girlfriend at the time and never saw her again. TLDR, I did a pelvic exam on a girl who ended up being a fellow medical student, though 2 years behind me, and asked me on a date at her follow-up appointment. Oh, I have another, examining vaginal smear samples for infection under a microscope in the lab, with Rihanna Rude Boy playing in the background on the radio. I'm hearing Rihanna moaning, take it, baby, baby. Come here, Rude Boy boy, are you big enough?" through the speakers, while looking down the microscope at slides of gonorrhea, chlamydia, bacterial vaginosis, and spermatozoa swimming around. Maybe not awkward, but fucking hilarious, K. TLDR looking through microscope at slides of STIs, while slutty music is playing on radio. Oh, I actually kind of have a remotely applicable story for once. So, my mom had a patient come in who was pregnant, but the woman weighed approximately 9 jillion pounds. Okay, probably not that much, but the woman was morbidly obese. I'm talking electric scooter fat. Can't really move under her own steam fat. Her husband, however, was on the small side of normal. So while the patient is there, everyone is wondering how did they possibly manage to have actual sexual intercourse, most likely more than once, if the lady not only can't move, but has 100 pounds of fat in the way of her vagina. My mom is a very sweet, matter-of-fact lady who can get away with Jewist about anything, and she genuinely wanted to know what had worked for this particular patient, so she just asked. The patient told her that she and her husband were desperate to get pregnant, that she was getting older and didn't know if she'd ever be able to lose the weight. She said that in order to have sex, she had her sister come over and use a broomstick with one end wedged into a dresser drawer to hold back her fat so that her husband could get close enough to actually have sex with her. Yep, where there's a will, there's a way. The woman had all kinds of complications, but ultimately delivered C-section, a very healthy baby. Super late to the thread here. Not an OB/GYN, different specialty, but I've done my share of vaginal exams. I once admitted a 300-plus pound mentally handicapped woman to the hospital for some non-GYN issue. However, she had what I suspected to be a raging case of bacterial vaginosis because her whole room smelled like rotten zombie vagina. It was so bad the nurses moved her to a single room and put a fan in her room to move some air. Unfortunately, this meant that I would, at some point, have to do a pelvic exam. I put it off the first day, which turned out to be a mistake. The following day, I showed up to check things out. The nurses informed me that her handicapped boyfriend had been in the room all day with the door shut. I walked in before the exam, and the room was literally saturated with the smell of vaginosis. It was so thick in the air, I swear it was precipitating on my skin. I get her all positioned and have my med students hold her thighs open for me. Yes, hold her thigh fat out of the way. I go in with the speculum. Her vaginal walls are collapsing around the sides of the speculum because of her size, making visualization difficult. She has an abhorrent amount of vaginal discharge, which was probably from her BV. At this point, I'm breathing through my mouth, because I know if I so much as sniffle, I'll probably gag. The med students are looking away with a look of horror on their face, obviously having made the rookie mistake of breathing through their nose. In addition to her vaginal discharge, however, I notice what is very clearly semen. To this day, I still see her semen-filled infected vagina when I close my eyes. Back in the day, I got a tattoo that says, "Lucky You," right above my pubes. I also still had my hymen until I was in my early 20s. When the nurse was asking me about my sexual history, I basically told her I didn't have one. She kind of scoffed and said, "But you're here." "Yeah, so don't worry about it." When the doctor examined me and found out I still had a hymen, she told the nurse, who was still in the room. The doctor asked if she could show the nurse. I said sure. The nurse asked if she could show the other nurses. I said sure. Then I showed them my tattoo, and they pretty much lost their shit. Apparently hymens aren't very common in gyno offices.